It has been demonstrated that the more the hour of brace wear, the best the results. As it is written in the 2011 SOSOT guidelines of conservative treatment, we know that the dosage of brace plays a major role in the results, even when we talk about the weaning period. So we demonstrated in a previous paper that compliance can be achieved, and we can, and patients can wear the brace even with a full-time prescription with good compliance. So we demonstrated that the use of a temperature sensor put into the brace, which we call Thermobrace, can contribute to research activity, but also to clinical activity, and it can optimize the therapeutical choices. We couldn't find any adverse effect on the relationship between patient, family, and physician. So, patients can wear the brace with high compliance, but this is the quality, the content of compliance. But what about the quality of brace wearing? Because at each prescription, we recommend patients to wear regularly the brace every day, the same number of hours. So the aim of the study was to find out if constant brace wear is rewarded with better bracing short-term results. This is a prospective control cohort study nested into a clinical database started in 2003, and from a population of quite 12,000 patients, we found 168 patients included into the study. The inclusion criteria were AIS, wearing a successful brace for 18 to 23 hours per day at their first prescription. All patients have an out-of-brace X-ray before the beginning of the treatment and an X-ray out of the brace after 4 months from the beginning of the treatment. Every patient decided for the Thermobrace adoption. We define the results as SRS criteria told us, and we define compliance, as you can read there. High compliance over 95% of the prescription, medium compliance between 17 and 94%, and low compliance below 70% of the prescription. Then we classify, according to the 1 hour interquartile range, the patients, and we have two groups, one with constant brace wear, and you can see the graph we obtain from our software. You can see the number of days per hour of wearing. So, for example, 20, I can't read over there, about 24 days with 23 hours of wearing, for this is an example. And the other group we call fecal patients, and they have an inconstant brace wear. So, for what concerns gender distribution, we have that in the fecal group we have almost male patients. If we consider high compliance patients, we can see that almost patients with high compliance were also constant compliant. And if we analyze compliance versus prescription in the two groups, we can see that constant have high compliance, while fecal tend to have medium or low compliance. We didn't find any affection by curve magnitude to the quality or the level of compliance. Then we calculated the relative risk of progression or stabilization in the short term, and we found that without a distinction for compliance, the relative risk for fecal patients was 1.35, and if we consider both quality and level of compliance, the relative risk is a little bit higher. So this is the first study investigating, in the short term, result checking content and quality of compliance. Wearing a brace very close to the prescription and consistently allow to achieve good results. To be constant in brace wear allows good results even if with medium compliance. So compliance is fundamental to achieve results. Fecal brace wear patients are at risk of curve progression, and we surely need further study to deepen the analysis of correlation between brace wear quality and content also in the long term. Thank you.